Here is the consent signed, number 28, Ship Harbor, and something blue. I'm doing it in my porch. My sister is volunteering. My mom is going to record. So before entering the room, I'm going to perform hand hygiene. Introduce myself. I am Shania Griffiths, the nurse. Going to perform the thoracic and respiratory assessment on you today. I'd like to ask a few questions to do a bit of health history background. Sure. Do you have any experience with shortness of breath? If so, how often does it come on? What's the severity and what brings it on?
No, I don't.
No? Okay. Do you have any history of lung disease or respiratory infections such as asthma, bronchitis, pneumonia?
No.
No? And do you smoke?
No.
Cigarettes? No. Alright, so I'm going to go ahead and get started. Initially, I'm going to start out looking at her overall appearance. Her posture is straight back. She's not hunched, slouched over with her hands on her knees, which you'd see typically in COPD patients. Her facial expression is neutral. She's not in no distress. The effort of her breathing is even. She's not. It's not rapid. It's not heavy. I'm going to palpate for any tenderness or pain in her arms. Let me know if anything hurts. And I'm going to assess the temperature and moisture of her skin with the dorsal of my hand, my fingers, and also check her lips and her fingernails for any cyanosis or pallor, and that's what her skin as well. That's deoxygenation. Next, I'm going to look at the symmetry of her chest wall, and make sure the costal migraine or angle is less than 90 degrees, which it is, which is fine. It's nice and even. I'm going to now do the chest expansion with my hands. If you can come closer. My hands will be on the my thumbs will be pointing towards the xiphoid process of the sternum here in the center and around the coastal margins of the ribs. And you can take a deep breath in. So you should see that my thumbs are expanding when she breathes in and out. And define. That's good as long as it's symmetrical. Her breathing is good. Any abnormalities, asymmetry with that could lead to pneumonia or like a fracture or trauma in the thoracic cage, like a rib fracture. I'm going to now also assess the trachea here and make sure it's in the center, just on top of her sternal angle in the sternal section there, which is good. And next I'm going to percuss, or I'm also going to check for tactile firmitis, which is vibration in the voice. You'll find it. I'm using the ulnar part of my hand. Do you want to repeat 99 for me?
99. 99.
And going from side to side.
99.
To make sure it's symmetry.
99.
To make sure it's symmetrical.
99. 99.
Okay, good. Now I'm going to percuss using my dip joint, which is my distal interphalangeal fleximeter joint, and my third flexor finger. So I'm going to start at the apex of the lungs and go from side to side to make sure it's even as well, and each side sounds the same. You'll mostly hear a resonance sound, which is like a soft, deep sound, and you'll sometimes get a flat sound over bone, and also over the liver and over the heart. You'll find a dullness sound, and the stomach will be more of tympany. Now I'm going to auscultate. Again, I'm going to start just above the clavicle here, using the diaphragm of my stethoscope, and take deep breaths in and out. The most common sound you'll hear here is visceral, which is also clear, soft noise. You'll sometimes hear a brachial sound up near the trachea, and brachiovisceral sound around like the mid-sternal line. And you're also going to check for the lateral side of the lungs as well. You want to make sure that you hear no crackles, which could suggest pneumonia. Wheezing could suggest asthma, and rhonchi could suggest bronchitis. So that's it for the front. I'm going to turn back on now to assess the back. I'm going to start out by inspecting the overall appearance of it. The chest, or the posterior trachea, posterior thorax, is in symmetry. I'm looking for any bone abnormalities or deformities such as scoliosis, scrophulus, barrel chest, and she's straight, she's symmetrical. And also I'm gonna palpate for tenderness or pain. Let me know if this hurts.
No.
Okay. Her posture is again upright, and the skin color is, check for cyanosis or pallor. And now I'm going to check for the chest expansion test to make sure her diaphragm moves up and down as planned. So my fingers are going to be over the posterior lateral thorax, and my thumbs are going to be at level 9 and 10 of the spine. So you can breathe in and out. And again, they should expand with the chest, which they do. So next I'm going to test for tactophragmitis again, and going down, you want to repeat the word 99?
99.
Using both sides.
99. 99. 99. 99. 99.
Using the ulnar part of my hand. Again, we should hear vibrations on both sides and make sure they're present and symmetrical. I'm going to percuss now, trying to stay within the scapular area, so we don't get the dull flat sound, or that flat sound, sorry, over the bone. Starting at the apex, going from side to side, using my dip joint again with my third flexor finger. When I check at T3, I'm checking the upper right and left lobe. And from T3 to T10, I'm checking the lower lobes. Now I'm going to palpate for diaphragmatic excursion. So when you breathe in and out, I'm going to palpate until I hear go from resonance to dull. So when I go from resonance to dull, that's the area of expansion for the diaphragm. That's palpating for the diaphragmatic, and it should be the same on both sides. And it's usually ranged from 3 to 5 centimeters. After palpating, I'm going to palpate for, like I said, any lesions, masses, tenderness, and it all seems to be normal. I'm going to auscultate. I'm going to use the diaphragm again, starting at the apex, in and out, going from side to side. Again, you're going to hear mostly visceral, which is like a low-pitched, clear sound. You'll kind of get a dull sound over the visceral and liver area again. And also check the lateral. Be sure to auscultate for the lateral sides of the lobe. And on the right side, the lung has 3 lobes. Be sure to. And that's around like the 6th intercostal space. You can also check for the voice. So you can auscultate. I'm going to get you to repeat the word E. And if normal, I should hear an E sound in my stethoscope.
E. E.
Good.
E.
So that's just one way to check the voice and to make sure everything is good. That concludes our examination. After this, I will document and then sign off. All right, thank you.